Welcome to today's deep dive, where
Yes.
we're taking a massive stack of recent clinical trials and aesthetic gynecology guidelines and really filtering them down to what you need to know.
Yeah, there's a lot of brand new therapy protocol data to go through today.
There really is. And our topic today is this medical breakthrough that sounds, incredibly complex on paper. It's vaginal skin booster microneedling with uncrosslinked hyaluronic acid.
Which is a mouthful.
It's a huge mouthful.
Yeah.
But our mission here is to figure out how these really cutting-edge therapies are being used to treat something called genitourinary syndrome of menopause, or GSM.
Right, GSM.
But before we get into the heavy clinical data and all the acronyms, I want you to picture something for a second.
Yeah.
You walk into a room. Right?
Okay.
It's pristine, gleaming white, soft, ambient lighting. You hear that quiet hum of state-of-the-art machinery. It basically feels like a futuristic sci-fi spa.
I can picture it.
And someone hands you a menu of treatments. And right there, right next to the facial rejuvenation stuff, is a treatment utilizing radiofrequency energy, microneedles, specialized serums.
You'd totally think we were talking about, like, the latest Hollywood secret for a glowing complexion.
Exactly. But we are actually talking about a profoundly functional, life-changing medical advancement for a completely different part of the body.
Yeah, the absolute cutting edge of skincare technology is, well, it's officially moving south.
Moving south, exactly.
It really does sound cosmetic when you first hear the terminology, skin boosters, microneedling, serums.
Yeah, it sounds like a day spa.
Right. But this is a deeply serious medical frontier. And to grasp the stakes here, we really have to look at the underlying biology of menopause.
Which we hear about all the time, right? The dropping estrogen.
We do, but we don't always talk about the cascading mechanical effects of that drop. Within the first 5 years of menopause, a woman's dermal collagen can plummet by up to 30%.
Wow, 30% in just 5 years.
Yeah, it's massive.
See, we hear about that 30% drop a lot, but usually in relation to facial wrinkles or, sagging skin on the jawline.
Exactly, but that systemic loss of collagen doesn't just stop at the neck.
Right.
Think of estrogen as, like the site foreman at a construction site, constantly yelling at your body's fibroblasts.
The factory worker.
Exactly, the factory workers. The foreman is yelling at them to keep producing fresh collagen, elastin, moisture. But when menopause hits, that foreman basically leaves the job site.
Oh, wow. So they just stop.
The fibroblasts just stop working, the factory shuts down. And while that obviously causes wrinkles on your face, the effect it has on the vaginal tissue is, well, it's catastrophic.
In looking at the sources we have, that biological shutdown leads directly to GSM, which impacts up to 84% of postmenopausal women.
84%.
That is just a staggering number.
Right.
84% of women are dealing with this. We're talking about severe dryness, a total loss of tissue elasticity, and, significant pain.
Yeah, the mucosal lining down there, which is supposed to be really thick, robust, heavily hydrated, it becomes incredibly thin and fragile.
Like tissue paper.
Very much like that. What was once this highly elastic environment becomes intensely susceptible to micro tears and irritation.
That sounds awful.
It is. It leads to painful intercourse, which is clinically known as dyspareunia. And this fundamentally alters a person's quality of life.
Absolutely.
Their intimate relationships, their daily comfort. They are quite literally losing the structural integrity of their tissue.
Okay, so let's unpack this. Because traditionally, the gold standard for treating this kind of severe atrophy has been estrogen, right?
Right. Local vaginal estrogen cream.
Right. You use the cream, you replace the missing foreman, and the factory starts up again. It helps rebuild the tissue.
That's the standard approach, yes.
But the major catch here, and this is what's driving all this new tech, is that estrogen is absolutely not an option for everyone.
No, not at all. For a massive subset of the population, estrogen is completely off the table. Think about patients with a history of hormone-sensitive cancers.
Right, breast cancer survivors.
Exactly. Many breast cancer survivors are put on medications that purposely eradicate any remaining estrogen in their bodies. They have to starve the cancer.
So you can't just introduce a local estrogen cream, even a mild one.
No, it's too risky. So for those patients, or anyone with undiagnosed bleeding or other contraindications, they've historically been left with very few effective options.
Usually they're just handed, over-the-counter lubricants?
Pretty much. Which offer fleeting, temporary relief, but they do absolutely nothing to rebuild the tissue.
Right, they're just a Band-Aid.
Exactly. And that is why this new non-hormonal regenerative approach is gaining such incredible traction in the medical community right now.
Okay, so if we can't use hormones to tell the body to fix itself, we have to supply the building blocks and the moisture directly. And the core ingredient in all of these new protocols is uncrosslinked hyaluronic acid. And I have to push back a little bit here
Go for it.
because I know you, the listener, probably have a hyaluronic acid serum sitting on your bathroom counter right now. I mean, I have one too.
Most people do these days.
Right. So isn't this just a trendy face ingredient? Are we really just taking a cosmetic face cream and, applying it where it doesn't belong?
It is a very fair question, and it's a super common misconception. But to understand why it belongs there, we have to look at what hyaluronic acid, or HA, actually is on a molecular level.
Okay, date on us.
It isn't some skincare invention born in a cosmetic lab. It's a naturally occurring molecule in the human body.
Oh, really?
Yeah, it's a glycosaminoglycan, which is essentially this massive, long-chain sugar molecule that's explicitly designed by nature to hold astonishing volumes of water.
I always like to think of it as like a biological sponge or almost like a natural WD-40 for the body's joints and tissues.
That sponge analogy is spot on. A single molecule of HA can hold up to 1,000 times its weight in water.
1,000 times. That's insane.
It is. But here's the crucial distinction we see highlighted across all our sources: the massive difference between cross-linked and uncross-linked hyaluronic acid.
Yes. I noticed that distinction everywhere in the clinical guidelines. Walk us through that difference, because it seems like the entire key to why this works medically instead of just cosmetically.
It really is. So cross-linked HA is what you find in dermal fillers.
Like lip fillers.
Exactly. The ones used to plump lips or contour cheeks. In a lab, the HA molecules are chemically bound or cross-linked together to create a thick, stable, rigid gel.
Oh.
Think of it like a chain link fence. It stays exactly where you put it to add structural volume and push the skin up.
Right, because you don't want your cheek filler migrating down to your jaw.
Exactly. But uncross-linked HA is completely different. The molecules flow freely. They're entirely unattached to one another.
So it's not a rigid gel at all.
Not at all. Instead of building physical scaffolding, uncross-linked HA spreads out. It's used exclusively for deep tissue hydration, smoothing, and restoring what we call the mucosal extracellular matrix.
Ah. So it isn't trying to change the shape or plump the tissue up like a water balloon.
No, definitely not.
It's literally sinking into the tissue to restore the baseline moisture that the estrogen drop took away.
Spot on. It forms this thin, deeply hydrating barrier layer that protects the fragile tissue from friction while actively supporting cellular repair over time.
Wow.
And the clinical evidence backing this up is incredibly robust. The studies show that vaginal hyaluronic acid is roughly comparable to low-dose vaginal estrogen when it comes to symptom relief.
Wait, really? Roughly comparable?
Yes.
That is wild to me. A completely non-hormonal sugar molecule is competing head-to-head with actual hormone replacement therapy.
The data is highly compelling. I mean, in these clinical trials, over 90% of participants noted significant improvement in symptoms like dryness, itching, and pain
And how fast are we talking?
in just 4 to 12 weeks of use.
Which is amazing. But I have to ask the skeptical question here.
Of course.
Is this a permanent fix? Or are we talking about, a lifelong subscription where a woman has to go get this applied every few months forever because the HA just dissolves?
That's a great point. It is an ongoing management strategy. It's not a permanent cure.
Because your body just naturally breaks it down over time.
Right. The body naturally metabolizes hyaluronic acid. However, it isn't just a temporary Band-Aid either.
How so?
Well, because you are restoring that extracellular matrix, you're giving the tissue a much healthier baseline. You are stopping the micro tears and preventing the chronic inflammation that actively accelerates aging.
Oh, I see.
So while maintenance is required, the overall health of the tissue is fundamentally elevated.
That makes a lot of sense.
Yeah.
And connecting this back to the breast cancer survivors you mentioned earlier,
Yeah.
for you or your loved ones navigating this is a massive deal.
Yeah.
It provides a highly effective, non-hormonal lifeline.
It really does. They finally have a first-line treatment that actually works on a structural level without carrying the risk of touching hormone receptors.
It truly changes the landscape of care.
Yeah.
But, we also have to acknowledge the limitations here.
We do. As effective as HA is, simply applying a gel or cream to the surface of the tissue isn't always enough.
Right.
For patients dealing with severe long-term tissue atrophy, Topical application just fails.
Which, if you think about it, makes perfect biological sense. Because if HA is this incredible biological sponge, why wouldn't the body just absorb it like a dry towel?
Exactly.
It's because the mucosal barrier is completely compromised. Our sources point out it's exactly like trying to water dry, highly compacted soil in the middle of a drought.
That's a great way to visualize it.
Right, if you just spray a hose on it, the water just runs right off the hard top layer. The roots get absolutely nothing.
Nothing at all.
So that explains the need for mesotherapy, or what the industry is calling skin boosters.
Yeah, skin boosters.
It's basically like aerating the lawn. You have to physically bypass that hardened surface and inject the water and fertilizer directly into the root system where it's actually needed.
What's fascinating here is how intricately tailored this mesotherapy process is for the vaginal mucosa. We aren't just injecting plain HA.
Oh, really?
No, the procedure involves very precise micro-injections of a highly customized cocktail.
A cocktail of what?
Well, the clinical sources point to specialized formulations like the patented HY6AA formula. You find that in products like Sunakos Inticare or Vivace's Deserial.
Oh, okay.
These mix uncrosslinked hyaluronic acid with a very specific blend of amino acids and antioxidants.
I actually saw those amino acids mentioned in the protocols. What are they actually doing down there?
Good question.
Because if the HA is the water for our dry soil, what are the amino acids doing?
Think of the amino acids as the raw bricks, and the HA as the mortar and the optimal environment.
Okay, bricks and mortar.
Right. The amino acids, things like glycine, proline, and lysine, they are the exact biological building blocks required to make new collagen.
Oh, I get it.
So while the uncross-linked HA floods the area with immediate hydration, the amino acids actively feed the surviving fibroblasts.
Waking them up?
Exactly, stimulating them to wake up and start producing new collagen and elastin fibers.
So you're hydrating the tissue while simultaneously force-feeding it the exact raw materials it needs to rebuild itself from the inside out.
That's exactly what's happening, and the standard clinical protocol reflects this intensive rebuilding phase.
What does that protocol look like?
It usually involves a series of 3 injection sessions, using about 3 milliliters of product per session, and they space them 14 to 21 days apart.
3 sessions, 14 to 21 days.
Right. And because it's delivered directly into the mucosa via mesotherapy, it mechanically and structurally supports tissue repair in a way topicals simply cannot achieve.
Wow. Okay, so mesotherapy provides this intense deep hydration and the basic biological bricks. It wakes up the factory. Right. But our sources point out that for some patients, the tissue degradation is so profound that just feeding it isn't enough.
Unfortunately, yeah.
The tissue requires total structural remodeling. And this brings us to the mechanical trauma aspect of our deep dive.
Here we go.
Microneedling combined with radiofrequency, or RF, energy. And I have to admit, I get incredibly hesitant here.
I know, it sounds intense.
I'm sure you, listening to this, are thinking the exact same thing. Wait a second. Rolling tiny needles down there sounds absolutely terrifying.
It does. The optics of it are very intimidating.
Are we just talking about taking one of those facial derma rollers you buy on the internet and, like, repurposing it?
No, absolutely not. I completely understand the hesitation, but let me clarify the medical science here. This is absolutely not standard cosmetic microneedling,
Okay.
and it should never, ever be performed with a derma roller. We are talking about highly specialized, computerized, medical-grade devices.
Devices like the Morpheus 8V or the Empower RF.
Exactly. They're engineered exclusively for the delicate mucosal tissue of the vagina, and they are only used in highly controlled medical settings.
Okay, but I still need to understand the mechanics here. Because purposely injuring an already painful, fragile area seems totally counterintuitive.
I know it sounds backward.
How does rolling needles and applying heat fix severe atrophy?
It relies on the body's evolutionary response to injury. So the device uses an array of ultrafine microneedles that penetrate the tissue at very specific computerized depths,
How deep are we talking?
usually between 1 to 3 millimeters. And as the needles reach that exact target depth, they simultaneously deliver a burst of fractional bipolar radiofrequency energy.
Okay, so it's a dual action process. The physical puncture of the needle plus a burst of thermal energy, or heat, directly into the deeper layers of the tissue.
Yes, but the key word there is fractional.
Fractional.
Right. It doesn't heat or burn the entire surface area. Fractional energy works like pixels on a screen.
Oh, interesting.
It creates tiny microscopic columns of thermal injury, but leaves completely healthy, untouched tissue all around those columns.
Ah, So you aren't nuking the entire area. You're leaving healthy tissue intact so it can act as a bridge, speeding up the healing process.
That's the crux of it. This controlled, fractional microinjury tricks the body. The body registers this as trauma, which immediately triggers a massive systemic healing cascade.
It rushes blood to the area.
Blood and growth factors. It induces two vital processes: neocollagenesis, which is the generation of new collagen, and neoangiogenesis, which is the formation of entirely new blood vessels.
And new blood vessels mean better blood flow, which means better natural lubrication, more oxygen, and fundamentally healthier tissue.
To take that a step further, look at the pivotal 2022 study on postmenopausal women that compared this kind of fractional radiofrequency microneedling to standard treatments.
What did they find?
The researchers did histological findings, meaning they actually biopsied the tissue and looked at the cells under a microscope before and after. They found a significant measurable increase in vimentin expression and type 3 collagen.
Let's break that down for a second. Why is type 3 collagen the one we care about?
So there are different types of collagen in the body. Type 1 is very rigid. It's what scar tissue is made of.
Right.
Type 3 is what we call the youthful collagen. It is highly elastic, flexible, and resilient.
And the vimentin?
Vimentin is a protein marker that basically proves fibroblasts are actively regenerating.
Oh, wow.
So finding an influx of type 3 collagen alongside vimentin means the tissue isn't just scarring over. It is actively remodeling and rejuvenating itself at a cellular level.
It's literally reversing the structural degradation caused by menopause.
Exactly.
That is an incredible biological response. But I have to imagine there's a dark side to this.
There's always a risk.
Right. Firing radiofrequency heat into delicate tissue with needles.
Hmm.
If you put a device like that in the hands of someone who doesn't know what they're doing, the burns or scarring could be catastrophic.
This raises an important question about safety, which we absolutely must address. The sources heavily emphasize reports from the FDA's MIU database.
That's the database that tracks adverse events for medical devices, right?
Correct. And the data is clear. When energy-based devices for vaginal rejuvenation are misused or used by underqualified personnel, the results can be devastating.
I would assume we're talking about severe pain, chronic burning, maybe even permanent nerve damage or scarring.
All of the above.
Yeah.
Using the wrong energy setting or going too deep can cause permanent thermal burns and severe scarring, which actually worsens the dyspareunia instead of fixing it.
That is terrifying.
It reinforces why these specific treatments are not a casual drop-in at your local med spa.
No, absolutely not.
They must be performed by board-certified specialists, urogynecologists, dermatologists, or highly trained aesthetic gynecologists who intimately understand the pelvic anatomy and the precise physics of the energy settings.
They have to know how to stimulate healing without causing destruction. Okay, so we've established the two main pillars of this new frontier. The RF microneedling rebuilds the heavy structural foundation of the tissue, while the uncrosslinked HA mesotherapy provides the essential hydration and the amino acid building blocks.
Right.
But here's where it gets really interesting. Clinicians aren't just choosing between these two options anymore.
No, they're not.
They are combining them into a single, multimodal powerhouse therapy.
This is where we are seeing the most remarkable clinical outcomes in the literature. Combining these treatments creates this compounding synergistic effect.
Best of both worlds.
Exactly. You take the absolute best of structural repair from the RF microneedling, and you pair it with the deep cellular hydration of the HA mesotherapy.
Our sources brought in some fascinating data on this from the 38th IUSTI Europe Congress, and they detailed a specific case study that really stuck with me.
Oh, the breast cancer survivor.
Yes, and I want to spend a minute on it because it paints such a vivid picture of why this matters. It was a 32-year-old breast cancer survivor. Just 32. Because of her intensive chemotherapy, her ovaries essentially shut down. She was thrown into early medically induced menopause in her early 30s.
Her case is a perfect illustration of the stakes here. She was suffering from severe, debilitating vaginal dryness and tissue atrophy.
Right.
The biological whiplash of losing estrogen so suddenly caused her internal tissue to age decades in a matter of months.
Oh, that's heartbreaking.
It is. And because her cancer was hormone receptor positive, standard estrogen therapy was a hard line she could not cross. Her quality of life and her intimate relationships were completely compromised.
So her clinical team used this new multimodal approach. But they didn't just jump straight to the lasers and needles, right? They had to sequence it carefully.
Sequence is everything in multimodal therapy. Think back to the dry soil analogy.
Okay.
If you fire intense radiofrequency heat into severely dehydrated fragile tissue, you risk burning it. It's like firing a laser into dry kindling.
Yikes. So what do they do first?
So the clinicians started with the mesotherapy. They injected the uncrosslinked hyaluronic acid and amino acids first.
They prepped the soil. They flooded the tissue with hydration and nutrients to build up some baseline resilience.
Precisely. Once the tissue was hydrated and the fibroblasts were primed, then they brought in the energy-based RF therapy to drive the deep structural regeneration.
So smart.
The HA acted as a protective buffer, allowing the RF energy to penetrate safely and effectively.
And the results from this sequenced approach were absolutely stunning. In just 7 months of this combined therapy, she experienced completely restored sexual comfort.
7 months?
7 months. The biopsy showed total mucosal regeneration and significantly improved tissue thickness.
They functionally gave a 32-year-old woman her life back, completely bypassing the massive risks of hormone exposure.
It's just incredible.
If we connect this to the bigger picture, what this multimodal combination therapy is doing is essentially tricking aging, damaged tissue into behaving like younger, healthier tissue.
It isn't masking the pain.
No.
It isn't just temporarily replacing lost moisture for a few hours like a drugstore lubricant.
Right, it's providing a holistic structural cure.
So what does this all mean? We've gone on quite a journey today through some heavy medical science. We started by understanding the fundamental biology of menopause, how the loss of estrogen shuts down the collagen factory and leads to the painful realities of GSM.
And then we explored how uncross-linked hyaluronic acid acts as a biological sponge, sinking deep into the tissue to deliver intense, hormone-free hydration.
We examined the physical hurdles of tissue absorption, learning how mesotherapy bypasses that hardened surface to feed the tissue directly with amino acids.
And finally, we looked at how the highly controlled fractional trauma of RF microneedling forces the body to rebuild its own vaginal walls from the inside out, replacing rigid scar tissue with youthful, elastic type 3 collagen.
And whether you are currently prepping for a medical consultation, maybe you're helping a partner, a mother, or an older relative navigate the incredibly frustrating realities of menopause, or you're just satisfying your own intense curiosity about where medical science is heading, the big takeaway is this.
The landscape of women's intimate health has evolved light years beyond the limited, often dismissive options of the past.
You don't just have to suffer in silence, and you don't have to rely on messy, temporary fixes.
The science of regenerative medicine is finally offering real functional restoration to a demographic that has historically been ignored.
Which is amazing.
It is, which leaves us with a rather profound paradigm shift to consider. We now possess the technology to biohack and regenerate intimate tissues using the exact same advanced, scientifically validated methods we have happily used for facial anti-aging for years.
Right. I mean, the skin boosters, the targeted microneedling, the deep hyaluronic acid hydration, we accept those as totally normal for our faces.
So the question becomes, as this technology becomes more accessible, how long will it be until vaginal longevity is no longer viewed as a taboo luxury or a desperate last resort for severe pain, but simply as a standard routine pillar of preventative health care for all women as they age?
That is a fascinating thought to mull over. If we proactively treat our faces to prevent structural aging, why wouldn't we treat our most vital, sensitive tissues with that exact same preventative care before the severe atrophy even sets in?
Exactly.
We've come a long way from that futuristic sci-fi spa we imagined at the start, straight into the reality of modern life-changing medicine.
Thank you
So much for joining us on this deep dive into the source material.
Thanks for having me.
Until next time, stay curious.